And please explain to them this concept of brainstem death that many are confused about.
The conventional understanding or conception about death is stoppage of heartbeat and patient lying totally unconscious, unresponsive, no breathing, no pulse, and no heartbeat. That is the conventional understanding of the death. The brain death or brain stem death, it is slightly a different concept. For instance, somebody unfortunately meets with a road traffic accident or a trauma or whatever. If there is a brainstem dysfunction or brain dysfunction, but still the heart is beating, such a person can be resuscitated in the form of connecting him to mechanical ventilation and inotropes and medicines and fluids, so that you can maintain the pulse, blood pressure, and the functioning of the major organs, but the brain is totally gone. So this is the stage at which we call it as a brain death. How to identify brain death? There are multiple mechanisms and multiple tests are there. Some are just clinically conducted tests by the experts as a neurophysician or a neurosurgeon or an intensivist. No response or to all the clinical tests. But as per the existing rule, the gold standard, the important test that has to be performed to identify brain death, we call it as apnea test. Let me try to explain what is apnea test all about. As I already said, the patient is on mechanical ventilator, artificial respiration. In such a person, what we do is that after ensuring certain parameters like a stable blood pressure, pulse, and so on, interrupt with the mechanical ventilation, disconnect the ventilator, but the oxygen will be flowing in through a tube. What happens during that time? If there is interruption in the mechanical ventilation, the carbon dioxide, which is normally exhaled or released out, will pile up in the blood. The concentration of carbon dioxide will increase in the blood. Whenever there is increase in the concentration of carbon dioxide in the blood, that will stimulate the brain or brain stem to go for spontaneous respiration. Carbon dioxide, we call it as a hypercarbia, will stimulate the respiratory center. Now, you ensure the carbon dioxide has increased in the blood of this person by doing ABG, arterial blood gas analysis. After increase in the carbon dioxide level also, if the patient has not made any voluntary effort at breathing, we call it as apnea test positive. So the brainstem has gone, it's not responsive to increased level of carbon dioxide. So this is apnea test. There are numbers and parameters and so on. And this has to be signed by 4 doctors. And again, the same test has to be repeated after 6 hours. So that's called it as a second apnea test. So both the apnea tests have to be positive, clearly, without any ambiguity. And each test has to be signed by 4 doctors. Then we proclaim brain death. At this point of time, if the family is willing to donate the organs, that will really give a second lease of life for so many patients. So what are the organs that can be retrieved from a brain dead person? Heart, both lungs, both kidneys, liver, pancreas, small intestine, stomach, skin,